Hey guys, it's Sarah here. In this video, I'm going to be going over all the medications that you need to know to pass the NCLEX. So I already did a video like this before, but I'm going to redo the whole series because I was talking too fast and it wasn't so clear. So before I get started, if you guys want to have the PDF or downloaded version, just click on the link below or go to my website www.sararn.com and go to the medication notes. So let's get started. The first class of medications that we're going to go over is called anticholinergic. What anticholinergic medications do is that they block the action of the neurotransmitter. So basically, they're inhibiting parasympathetic nerves. Okay, this affects a lot of systems of ours. And a way to know which system it affects is by using a mnemonic, which is also the mnemonic for the side effects of it. Because it's affecting that system, it's going to be a side effect. So the mnemonic is can see, can pee, can spit, and can shit. So can see is the side effect of blurred vision. Can pee is a side effect of urinary retention. Can spit has a side effect of dry mouth, and can shit has a side effect of constipation. So who is this class of medication contraindicated for? So in general, if you look at the side effects, you can know who is contraindicated for it. So over here, one of the side effects are can't shit, which is constipation. So anybody that's really constipated, or let's say has a bowel ileus, then it's contraindicated. The same thing goes for can't see, which is blurred vision. So it's going to be contraindicated in someone with closed-angle glaucoma. And so on. Can pee, urinary retention. So someone with urinary retention or BPH, it's going to be contraindicated. So examples of medications that are anticholinergic. The antidepressant class, called TCA, tricyclic antidepressant, are anticholinergics. Many antihistamines are anticholinergic. Some medications like oxybutynin, tolterodone, sulfenazine, they are all used to treat overactive bladder. Because like we said, one of the side effects are can't pee. So if you have someone who has an overactive bladder, you would want to give them something that causes them to retain. And another medication that's an anticholinergic is dicyclomine. Dicyclomine is used to treat irritable bowel syndrome. As we said, can see, can pee, can spit, and can shit. Another medication that falls under anticholinergics are atropine. Okay, atropine I would know. Atropine is given to increase the heart rate for patients with symptomatic bradycardia. If patients have bradycardia with no symptoms, we don't treat it. We just monitor. If patients have symptomatic bradycardia, then we give atropine. So also atropine could be used for dry patient secretions with the death rattle. So as we said, one of the side effects are can't spit. So that's why you would want to give it to a patient with a lot of secretions. The last anticholinergic I'm going to talk about is benzotropine. So this is used to treat extrapyramidal symptoms from antipsychotic medications. So the reason why you should know this under anticholinergic is because let's just say you would have a question about benzotropine and the side effects. So all you have to remember is anticholinergic, and then you'll remember can see, can pee, can spit, and can shit. And then you'll remember all the side effects. Okay. So the next medication that we're going to go on to is proton pump inhibitors, PPI for short. So proton pump inhibitors end in prazole. So pantoprazole, lansoprazole, omeprazole. A hint to remember this is PPI, so another P. So one P is for proton pump inhibitors, and one P is for prazole. Just remember P and P. So proton pump inhibitors are used to decrease the acid in the stomach. So proton pump inhibitors, what they do is that they decrease stomach acid production. What you have to remember about this is that you want to take it 30 minutes before meals. Because think about it, usually people have acid reflux and stuff like that from meals, so you want to give it before to prevent it. The main thing you want to watch out for here is two things: diarrhea and C. diff, and also osteoporosis. Because if it's taken long term, it decreases the calcium absorption, which could cause osteoporosis. And the reason why it could cause diarrhea or C. diff is that because it suppresses acid, so it ruins the normal flora in the body. The next medication that we're going to discuss is metoclopramide. This is known as Reglan. So this is also a GI medication that is used for delayed gastric emptying, GERD, and also as an antiemetic. So what this does is that it increases the GI motility and promotes stomach emptying. So side effects that someone could get from long-term use are sedation, restlessness, headache, dry mouth, constipation, etc. But the side effect that you want to watch out for here is called EPS, extrapyramidal symptoms, like tardive dyskinesia. So in general, when I say side effects, if I say a side effect of like headache, sleepiness, and stuff like that, those are not side effects that you really have to memorize, because not all side effects are bad. It's not like you're going to have to rush and tell the doctor, oh no, he's sleepy, oh no, he has a headache. The side effects that could cause long-term damage or be really harmful to the patient, that's what you want to know. So in this example, you have restlessness, headache as side effects, but the one that really you should remember is the extrapyramidal symptoms, like tardive dyskinesia. And just a side point, to reverse those symptoms, you want to give benzotropine. So the next GI medication is antacids. As we all know, they're used for GI ulcers. One of the medications is called sucralfate. So this is an antacid that, like I said before, GI medication, so it's given before meals with water. The next GI medication is fiber. Some examples include bran, psyllium. So these are good for like someone who's constipated, it helps things move around. An antidiarrheal that is used is loperamide, Imodium. So with this, you want to know that you do not want to use it for more than 2 days. And the reason that is because if you think about it, when someone has diarrhea, they have an electrolyte imbalance. So if you use them more than 2 days, that could be very dangerous. The next medication class that you should know is for tuberculosis. What you should know about tuberculosis medications is that they are all hepatotoxic. They all cause liver damage. The only one that doesn't is ethambutol. Because it's hepatotoxic, you want to avoid other hepatotoxic stuff like alcohol, Tylenol, and you want to do a baseline liver function test. One of the tuberculosis medication is called rifampin. So one of the symptoms are red, orange body fluids, like tears, could be that color, sweat. So you want to tell the patient not to worry, and it's a normal side effect. But you do want to tell them to use non-hormonal birth control because it could decrease the effectiveness of oral contraceptives. The next tuberculosis medication is isoniazid. So this is used to treat latent TB. So it's not yet active, it's latent. Side effects are peripheral neuropathy. So that's a serious thing, I would remember that. And you want to tell them to take vitamin B6 to prevent that. The last tuberculosis medication we're going to talk about is ethambutol, and that's to treat active TB. So like I said before, that's the only one that is not hepatotoxic, but a side effect of that is optic neuritis. The next class of medications are antipsychotics, which are used to treat schizophrenia. There are different types. They're divided into typical and atypical. So typical include haloperidol and fluphenazine. Atypical include clozapine, risperidone, olanzapine. So these I would know because to test on these are very common. NCLEX like to. So what I would know from these ones is which one is a typical and atypical. And for clozapine, one of the main adverse effects of that is agranulocytosis, which means a decrease in neutrophils. So this is obviously very severe side effect, so it's not used for most patients. It's only used for patients who are not responding to any other drugs. So because it decreases neutrophils, before starting it, you need the white blood count to be above 36,500. And you need the absolute neutrophils to be above 2,000. And you want to tell the doctor immediately if you have any sign of infection like fever, sore throat, flu-like symptoms, etc. And the other medication I would know from this one is ziprasidone. So what you should know for that is that it has a risk for QT prolongation. So you want to do a baseline EKG and potassium check and place the patient on a cardiac monitor. Antidepressants. So the main things I would know about antidepressants is that first of all, there are different classes. You don't want to use one class with the other class. And also, that with all the antidepressants, you always want to watch out for worsening depression, which could be a hint for suicidal. Because there's an increased risk for suicidal thoughts with taking the antidepressants first. So the class of antidepressants I would know also, because they like to test on that. The first class we're going to talk about is MAOI. These include felfenazine, tranicyclamine, isocarboxide, etc. The main thing you want to know with MAOIs is you do not want to eat foods that are high in tyramine because they could cause a hypertensive crisis. The next class is called atypical antidepressants. These include bupropion, which is Wellbutrin. So, okay, the next class is TCA, tricyclic antidepressant. So these include amitriptyline, nortriptyline. They all end in triptyline. Some side effects for these are urinary retention, photosensitivity, etc. Okay, so amitriptyline in specific could cause cardiac toxicity and neurodisturbances. You do not want to take them you do not want to take it with alcohol. The next class of medications is SSRI, selective serotonin reuptake inhibitor. So these include citalopram, sertraline, paroxetine, fluoxetine. They all end in pram or -ine, like line, tine. So what you want to know for these is that they could be increased by herbs like St. John's wort, so you don't want to take it with that. And side effects could cause weight gain or weight loss, GI side effects, headache, sexual dysfunction, but these side effects go away over 3 months gradually. With all antidepressants, one more point is that they usually take a time period like 2 weeks in between till you start seeing effects. And in that time, you really want to watch out for suicidal thoughts. Okay, so serotonin. Okay, so one more point about the SSRI that I forgot to add, that's very important, is that there's something called serotonin syndrome. Okay, so serotonin syndrome is when your body has too much serotonin. So this could cause severe side effects like mental status change, autonomic dysregulation, diaphoresis, tachycardia, and neuromuscular hyperactivity. The next medication is trazodone. Okay, two other antidepressants are trazodone and duloxetine. The trazodone is especially used for people with insomnia and depression together. And duloxetine, besides for being an antidepressant, also relieves pain. Okay, so next we go on to stimulants. So stimulants are used for ADHD, which honestly, I always thought was funny because you would think someone with ADHD needs like a non-stimulant. But that's an easy way to remember it. Stimulant, and people who are usually stimulated, are ADHD. So medications in this class include methylphenidate, dextroamphetamine, dextroamphetamine. So they have a common ending of amphetamine. So side effects for stimulants are insomnia, weight loss, headache, irritability, restlessness, and tachycardia. There is a risk for interruption of growth and development. So you want to compare their weight and height each checkup. The next class of medications are to help people with nocturnal enuresis, aka bedwetting. So like I said before, TCAs, tricyclic antidepressants, specifically amitriptyline, could be used for this. But another class of medication that is used for nocturnal enuresis is desmopressin. So this is an antidiuretic. What you want to do here is you want to monitor for symptoms of water intoxication and hyponatremia. The next class of medications I'm going to talk about is lithium. So lithium is used for bipolar mania. It could be toxic, and toxicity symptoms of lithium, which I would know, involve GI, neuro, and if severe, like seizures. So GI would include nausea, vomiting, diarrhea, and neuro would include tremors, confusions, ataxia, sluggishness, etc. The therapeutic level is 0.6 to 1.2, which I would know also. It is excreted through the kidneys, so you want the person to have a lot of fluid to flush it out. So toxicity occurs with dehydration, decreased renal function, or low sodium. The next class of medications are anticonvulsants. So what these are used for is to treat seizure patients. So with anticonvulsants, what you should know is that they depress the CNS. They could cause suicide ideations and can trigger Stevens-Johnson syndrome, which could be very dangerous. So, first of all, because it depresses the CNS, you do not want to drink or operate heavy machinery while taking it. Some examples of anticonvulsants are carbamazepine, phenytoin, which is Dilantin, gabapentin, valproic acid, and levetiracetam, which is Keppra. So, carbamazepine could also be used for pain and has a side effect of agranulocytosis, like we talked about before. So you want to report any signs of fever or getting sick, etc. So phenytoin, you want the range to be between 10 to 20, and a major side effect is gingival hyperplasia. You want to watch out for symptoms of early toxicity because you want to prevent it, which would include gait unsteadiness, then goes slurred speech, lethargy, confusion, and then goes coma. The symptoms of phenytoin toxicity include gait disturbances, so ataxia, gum hyperplasia, slurred speech, nystagmus, ataxia, and encephalopathy. So phenytoin decreases the effectiveness of some medications like oral contraceptives and warfarin. It could also cause Stevens-Johnson syndrome, and you do not want to use it in pregnancy. Gabapentin could also be used as a neuropathic pain reliever, and valproic acid could also be used in bipolar. The next class of medications are antitussive. So these are used to prevent and relieve cough. These include dextromethorphan and codeine. The next class of medications are expectorants. So I'm just going to group two of them together, expectorants and mucolytics. So what expectorants are is that they thin mucus in the airway, and mucolytics also thin mucus, but in the lungs. And included under these categories are the medications named as guaifenesin and acetylcysteine. Another medication is called theophylline, and that's a bronchodilator. The next class of medications are asthma medications. So with asthmatic patients, you do not want to give beta blockers or NSAIDs. And your goal is to get the oxygen saturation to be more than 90. So for asthma, there's short-term treatments and long-term treatments. For short-acting, like exacerbations, you want to give albuterol or levobuterol with an anticholinergic such as ipratropium every 20 minutes, and with a systemic steroid like salumedrol for the inflammation. For long-acting, you want to give salmeterol. This is given with steroids for long-term asthma control. Other asthma medications include montelukast, tiotropium, which is a bronchodilator, and theophylline, which is also a bronchodilator. The next class of medications are biphosphonates. So these are used to prevent the loss of bone density, and it includes a medication called alendronate, risodronate, alendronate. What you want to do is you want to tell them to take it in the morning on an early stomach, 30 minutes before any other medication, and to take calcium and vitamin D with it. The next class of medications are alpha adrenergic blockers. These are used to treat BPH and also to treat urinary retention caused by BPH. So these include doxazosin, terazosin, tamsulosin. They all end in -sin. What this medication does is that it relaxes the smooth muscle in the bladder, but it also relaxes the smooth muscle in the vascular. So you want to watch out for hypotension, syncope, falls, etc. The next class of medications are antifungal. So these include fluconazole, nystatin, terbinafine. The next class of medications that we're going to talk about is antibiotics. Antibiotics each fall into a different category, and they could be a little confusing. So let's start. So here's just general antibiotic rules. With antibiotics, frequent liquid stool could indicate C. diff infection, which is very common if you're taking antibiotics for a little bit too long. People give prophylactic antibiotics before dental procedure for patients with repaired valves, history of infectious endocarditis, and prosthetic valve replacement. Most antibiotics, if not all, they ruin the gut health. They ruin the normal flora living in the stomach. So now for different antibiotics. Metronidazole is used to treat C. diff, IBD. Some side effects for that is metallic taste, GI upset, and dark color urine. And you do not want them taking alcohol for 48 hours after. The next medication is vancomycin. The main thing you want to watch out for here is red man syndrome, which is like facial upper body flushing, which could be very dangerous. So you want to infuse it over 60 minutes, not shorter. You want to monitor the trough level before giving vancomycin, and the therapeutic level should be 10 to 20. So vancomycin toxicity includes nephrotoxicity, ototoxicity, etc. The next antibiotic class is macrolides, which all end in mycin, azithromycin, clarithromycin. What you want to remember for these is that they have a prolonged QT interval. So think of cardiac, do EKG, put them on a cardiac monitor, and it's also hepatotoxic. The next class is aminoglycosides, which include streptomycin, gentamicin, tobramycin, etc. Some serious side effects are ototoxicity. So think of ringing in the ear, vertigo, and also nephrotoxicity. So you want to check the creatinine, the urine output, the kidney function, etc. The next class of medication are cephalosporin, which include cefazolin, ceftriaxone, etc. So the next class of medications are fluoroquinolones, which include ciprofloxacin, levofloxacin. They all end in fluoxacin. Fluoroquinolone has a black box warning for tendinitis and tendon rupture. So at the first sight of tendon pain or swelling, stop taking and don't move that area. The next class of antibiotics are quinolone, which include levofloxacin. You should just know that with this, you want to wait 2 hours between taking this drug and consuming aluminum, or magnesium antacids, iron, or anything like that. The next class of antibiotics medications are tetracycline. These will end in cycline. So doxycycline, tetracycline, etc. You want to avoid doxycycline in pregnancy completely, and they could cause photosensitivity. and they also decrease the effectiveness of oral contraceptives. So the last class of antibiotics we're going to discuss is penicillin, which include amoxicillin, ampicillin, etc. So what you want to know for this is that it has a cross-sensitivity to cephalosporin. So you want to find out what happens when they take cephalosporin and see if they'll have the same side effect. So now we go on to medications that help you stop smoking. So it includes nicotine, which can be given through a patch, gum, inhalers. And the other two medications are varenicline or bupropion, which both have side effects of neuropsych side effects like depression, suicide, etc. Next we go on to alcohol cessation drugs. So the main one you have to know is disulfiram. This is actually an aversion therapy. So what this means is that when it gives a person side effects when they have alcohol, that makes them not want to drink it again. You should know this is not a cure for them, and too much is fatal, so you actually need to get informed consent before giving it to them. And you really want to let the patient know about the dangers of drinking alcohol while taking this medication, and about hidden sources that have alcohol that they wouldn't know of, like cough medications, aftershave lotions, cologne, mouthwash, vinegar, flavor extracts, etc. So you want to let them wear a bracelet alerting other people of the allergy, like of alcohol. The next medication is magnesium sulfate. This I would know very well. So magnesium sulfate is used for seizures prophylactically with patients with preeclampsia. It is also used to treat hypomagnesemia and torsades de pointes, which is a type of arrhythmia. I wouldn't really know the loading dose, you don't really have to know that. You just want to know what the therapeutic level is to know when it's toxic. So the therapeutic level is 4 to 7, which means anything above 7 is toxicity. And you should know the signs of that, so you know when the patient has too much magnesium. And the signs are CNS signs and no deep tendon reflux, and a urinary output of less than 30 milliliters per hour. Okay, so now we go on to medications that help to lower the blood pressure. I would know these because the whole world's on antihypertensive, so these you're going to see in your daily life a lot. So they're divided into different classes. The first class is calcium channel blocker. As the name says, it blocks the entry of calcium into the heart muscle. So these include peripherally acting ones. So they all end in dipine. So nifedipine, amlodipine, nicardipine. So I would just remember this as dipine, like we depend on it, you know? Some side effects are peripheral edema. So just remember it's peripheral acting, peripheral edema. Constipation, orthostatic hypertension, dizziness, flushing, headache. So with all medications that could lower your blood pressure, a side effect could be orthostatic hypertension, and that they become dizzy, and because it's lowering your blood pressure. But with calcium channel blockers, you want to remember, do not take them with grapefruit juice. And in general, for all these blood pressure medications, you don't want to give it if the systolic blood pressure is lower than 90, because it's just going to lower it even more. So it's usually 100 to 90, you don't want to give it. The next class of medications are ACE inhibitors. So ACE inhibitor stands for an angiotensin converting enzyme. So basically, it decreases the production of angiotensin II, which dilates the blood vessels, so blood pressure is reduced. Because think about it, if you have a small little straw and you're trying to fit some, and the blood's trying to get in there versus a large straw, and the blood pressure is getting in there, the blood pressure is going to be way higher in the small one. So if you dilate it, the blood pressure decreases. So these all end in pril: lisinopril, captopril, and enalapril. The side effects are orthostatic hypotension, which goes for all blood pressure medications, hyperkalemia, cough, angioedema, and increased creatinine. So I would know all them as stand up. So obviously they all have orthostatic hypertension, so knock that off. I would remember hyperkalemia, because that could be very dangerous, a cough, and angioedema, because that could cause obstruction of the airway, which is very dangerous. So the next class of medications are beta blockers. So what beta blockers do is that they block the effects of epinephrine. So they cause the heart to beat more slow with less force, which lowers the blood pressure. Beta blockers include beta 1 and beta 2. So they all end in lol. So metoprolol, atenolol. There are two different classes. One's selective and one's non-selective. So selective beta blockers only work on the beta 1 receptor, which is the heart. Non-selective work on both. So they also work on beta 2. Beta 2 involves the lungs. So non-selective include propranolol and nadolol. So these ones, because they work on the lungs and they vasodilate, you do not want to give it to a patient with asthma or respiratory problems. But the selective ones, like metoprolol, atenolol, those ones you could give to any of the patients. So side effects for these are bradycardia, bronchospasms, depression, and decreased libido, so erectile dysfunction. Another one included in this category, which is timolol, which is used for an eye treatment to treat high pressure in the eye from glaucoma. We do not want to use beta blockers in pregnancy. A hint to remember that is like baby, so don't use it in pregnancy. And also, like olol, they both have two O's and two L's, so beta blocker has two B's. And that's how you remember that. So the next ones are A2 receptor blockers. So that stands for angiotensin 2 receptor blockers. So angiotensin, so vasoconstriction. So if they're blocking it, the blood vessels are going to vasodilate and the blood pressure is going to be reduced. So all you have to know for that one really is that the side effect is hyperkalemia, and you do not want to use it in pregnancy. You can also remember like 2 for mom and baby, don't use it in pregnancy. The next one is nitrates. So nitrates are easy because they have the word like nit in it. So nitropyrosate, nitropras, isosorbate, dinitrate. So those are vasodilators. So nitropyroside is a vasodilator that is used in hypertensive emergencies. What you should know about that is that it could cause cyanide toxicity with renal disease. Isosorbate dinitrate is a long-acting to prevent angina, which is like chest pain. So side effects for nitrates include hypotension, headache, and flushing. You do not want to take erectile dysfunction medication with nitrates or alpha blockers. So here's instructions to tell people at home. They should take the medication. If the pain is not relieved, they should call 911 and take another one. They could do this up to 3 doses, 5 minutes apart for each dose. You want to remember to store it away from light or heat source, which includes body heat, And you want to keep the tablets in the original container because they're heat and light sensitive. You want to replace them every 6 months. And a normal side effect is tingling sensation under the tongue, which is actually good. You want that to occur. Nitrates are used for stable angina, not unstable. So unstable angina would be occurring at rest, and stable angina would be only by movement, etc. If it's used in a patch form, it's used once a day, and it's worn for like 12 to 14 hours, and then it's removed. You do not want to wear more than one patch at a time, and you want to apply to clean, dry, hairless skin that's not cracked. And remember to rotate sites. You can wear it in the shower. Okay, the next class of medications are muscle relaxants. These are metabolized by the liver, so if anyone has liver disease, you want to clarify with his doctor if they should be taking it. The first one is baclofen, and I like to remember this as like back, so you have back pain, so it's a muscle relaxer. It relaxes the muscle and is used a lot for multiple sclerosis to relieve uncomfortable muscle pain and spasms. Side effect is orthostatic hypotension. The next one is cyclobenzaprine, which is Flexeril. It's easy to remember, like flexible, muscle relaxants, etc. So this is actually a centrally acting skeletal muscle relaxant that's used for fibromyalgia, or muscle spasm, rigidity, pain, injury. So you don't really have to know exactly what it's used for, like just know the class, it's a muscle relaxant, because it's not your job to diagnose, it's the doctor's job to diagnose. So you just have to know in the category, a muscle relaxant, it relaxes the muscle, so the patient has back pain, and like the side effects of that, because that's what you're going to be monitoring as a nurse. Another muscle relaxant is succinylcholine. Yeah, so this is used actually for short-term paralysis as a part of general anesthesia. So this is usually done when they're intubating the patient, etc. Another type of muscle relaxant is IV dantrolene. So this is used to reverse malignant hyperthermia. I would know that one. Some other muscle relaxants are carbidopa and methocarbamol. The next class of medications are anti-anxiety. So the first one we're going to discuss is buspirone. So this one has no CNS effect and has very low potential for abuse. So there's no withdrawal or dependent symptoms. It takes 1 week to see some symptom relief and about 4 to 6 weeks to see the full effect, which is why it might not be your first line sometimes. Another class of anti-anxiety medications are benzodiazepines. These are all CNS depressants, so like they're sedatives, and also used for anti-anxiety. So these end in PAM or AM, like alprazolam, midazolam, lorazepam, midazolam. So benzodiazepines are CNS depressants, so they could depress the respiratory center, so you do not want to use it with COPD patients or patients who already have a compromised respiratory center. If someone overdosed on it, which is very common, you want to give them flumazenil. Okay, so the next class of medications are diabetic medications. So these I would know also, because along with heart medications, a lot of people are on diabetes medications. The most common one is metformin, glucophage, because this is a first-line medication used for diabetes mellitus type 2. The side effect of that is lactic acidosis in patients with kidney disease or GI upset, which is like nausea, vomiting, metallic taste. You want to discontinue it if they're taking IV contrast and restart it 48 hours after. With metformin, which is why it's so commonly used, there's hardly any risk for hypoglycemia. Some other diabetic medications, they end in "-one", so rosuvastatin, pioglitazone. So these have an increased risk for bladder cancer, and they could worsen heart failure. So you don't want to give it to patients with heart failure or volume overload. Another type is sulfonylurea. So these are also a diabetic medication, and these include glipizide, glyburide, they all start with glim, GL, So these have a side effect of hypoglycemia and weight gain. You want to tell the patients to use sunscreen or protective clothing and take them before meals to prevent hypoglycemia. The next one is glucagon. So this stimulates the liver to convert glycogen into glucose. Okay, if someone is hypoglycemic, you want to give them a simple carb of glucose. But if they can't ingest it, or if you don't have any glucose available, like sugar or something like that, then you could give them glucagon. You want to watch for rebound hypoglycemia, and it is given IM. The next one, which we probably all know, is insulin, which lowers the blood glucose levels. There are different types. So there are 4 different categories. The first one is rapid acting. They work right away. So this includes Lispro, which is Humalog, Aspart, which is Novolog. When it says rapid acting, it means that its peak effect occurs at 30 minutes to 3 hours after. So between that time, you want to watch for hypoglycemia, because that's when it's lowering the blood glucose peak effect. You only give this if you're certain the patient will eat within 15 minutes, so it doesn't take it too low. The next one is short acting, which is regular insulin. This reaches its peak effect 2 to 5 hours later. So the risk of hypoglycemia is at 2 to 5 hours. It's given sub-Q. The next one is intermediate acting, NPH. A peak effect that could cause hypoglycemia occurs 5 to 6 hours after taken. And the last one is the long-acting one, which is Detemir, Glargine, which is Lantus, is used once or twice daily. There is no peak, so that means that it doesn't matter when the patient eats the food. And it is used long-acting to prevent hypoglycemia for 24 hours. So they like when you know the insulins and the peak effect. If you need a hint or anything, you want me to make a video on that, just shoot it out in the comments and I can make a video on how to remember which insulin and which diabetic medication. So you just want to remember with all diabetes medications that even when the labs are good, you want to give insulin, because you want it to continue to remain good. If you want to mix 2 insulins together, you could, but you cannot mix it with any long-actings. So this is how you would mix it. So you would clean your vials with alcohol swabs, inject ear into NPH, withdraw the needle, and put that ear into regular. You want to turn the regular upside down with the needle in it, and withdraw the regular insulin into the syringe. Take it out and put it back into NPH. So like a hint that people like to remember is RN, R before N. Regular before NPH is what you're going to be withdrawing. What you want to know for insulin is that it could cause hypokalemia. So when they give insulin, they like to give a potassium supplement. Okay, Now we go on to opioids. So opioids are used to relieve pain. Side effects are vasodilation, hypotension, urinary retention, itching, flushing, nausea, vomiting, constipation. And constipation is a big one with opioids. You do not want to give opioids to a patient with head injury. Okay, so before we talk about the actual opioids, we should just know that naloxone, which is Narcan, is a reversal agent for overdose of opioids. It has a very short half-life, so you want to repeat it if necessary. And it could depress the respiratory center, so don't use it with COPD patients. So some types of opioids are morphine, codeine, tramadol, hydrocodone, methadone. So methadone is actually used to treat pain and to treat narcotic drug addiction. The early signs of toxicity of it is nausea, vomiting, lethargy, respiratory depression. Another opioid is hydromorphone. Another one is butorphanol. So these are actually used in labor in the active phase of stage 1 when contractions are established and the person's more than 4 centimeters dilated. Another opioid is fentanyl. So for fentanyl, it is given IV for acute pain, or it's used in a transdermal patch, which is called Duragesics, for chronic pain. If it's given patch-wise, you want to replace the patch every 72 hours. Remove the old one, put on the new one. You want to fold the old patch and disregard it immediately. So you can't just disregard it in the garbage. You have to ask your hospital policy or wherever you're working how to disregard it. You don't want to place the patch over heat. You don't want to cut it. And you want to put on an area that has intact skin, clean, very little hair, flat. It does not have to be on the site with pain. Another opioid is imperidine. This is also used, so this is actually used in early labor. It has a 5-minute onset through IV, but you want to avoid this within 1 to 4 hours of birth because it could cause neonatal respiratory depression. So with all opioids, I would remember the side effects of respiratory depression, that's a big one, constipation, regular GI ones, urinary retention, and hypotension. The next class is NSAIDs, non-steroidal anti-inflammatory. These are also to relieve pain, but they're not narcotics. NSAIDs, what you want to know about that is they have an increased risk for thrombolytic activity. So you want to avoid them in patients at risk for fall because they could bleed out, because they could bleed a lot, and patients with low platelets. You want to monitor for signs of bleeding, and with all NSAIDs, it could cause GI toxicity, which you would have like GI bleeding symptoms, so black, tarry stool. It could cause GI upset. As you could tell, it affects the GI system a lot. So like pain, dyspepsia. So you want to take them with food to avoid that. It also could cause kidney injury and peptic ulcers if you use it long term. Do not use NSAIDs with asthmatic patients because it can exacerbate asthma symptoms. Some examples are indomethacin, naproxen, ibuprofen, which is Motrin, Advil, acetylsalicylic acid, which is abbreviated ASA, or just known as aspirin, and Toradol, which is Ketorolac. Another one is celecoxib. I would know that it has a black box warning for increased risk of heart complications. Another one is indomethacin, which could also actually be used to treat patent ductus arteriosus. Okay, the next class of medications are corticosteroids. So they're also actually known as steroids, corticosteroids, and they're used to decrease inflammation. They all end in "-one" or "-sone", so hydrocortisone, dexamethasone, prednisone. So I would just remember like "own", like I own it, someone on steroids thinking the world of himself, like that. With all steroids, you never want to discontinue it abruptly, and you want to increase the dose in times of stress. Side effects include cataracts, so you want them to have a yearly eye appointment, GI irritation, so don't take it on an empty stomach, mood swings, and irritability, which are normal to have with steroids. Other side effects that you want to seek out help for is buffalo hump, moon-shaped face, hypokalemia, increased weight, increased blood pressure, increased glucose, so you want to monitor the glucose levels. It could also lead to osteoporosis or muscle weakening, so you want them to have a high calcium diet and protein. The next class of medications are antinoplastic, which is anti-cancer medications. You should know that the white blood cell count is at the lowest at nadir, which is 7 to 10 days after chemo starts. Some type of medications are cisplatin, tamoxifen, which is used to treat breast cancer and prevent breast cancer, cyclophosphamide, and methotrexate, which is actually a DMARD. So I wouldn't really know these ones so much because like oncology is like a specialty more like, so they won't really test you on this. But I guess I would know methotrexate because that's also a DMARD, which is for antiarrhythmic. And side effects for cancer for chemos are basically everything. You know, they ruin the kidney, they ruin basically like everything. The next medication I would talk about is hydroxychloroquine. This is actually an anti-malaria, and side effects include retinal damage, so you want eye exams every 6 months. It could take several months to see the effect, and side effects include renal toxicity, visual disturbances. The next class of medications are immunosuppressants, which are also called TNF, which is tumor necrotic factor inhibitors. So these include etanercept, infliximab, and they reduce the manifestation of rheumatoid arthritis and slow the progression of joint damage because they stop the inflammatory response. It could also be used for Crohn's, just things that they want to stop the inflammatory response. You want them to have a baseline TST test before and a skin test after. If you want to see the effectiveness of it, you should look at the CRP, C-reactive protein. You want to report any elevated white blood count, and it could activate latent TB. So like I said before, you want to do a TST test before and yearly. Immunosuppressive drugs. So they suppress the bone marrow and they put the patient at risk for infection. These include cyclosporin, azathioprine, and like the other ones, they could convert latent TB to active TB. So with any immunosuppressant drug, because you're suppressing the immune system, if anyone has a fever or any sign of infection, you want to report it immediately because they don't have the immune system to fight back. The next class of medications are diuretics. So what these do is that they increase the urinary output. side effects are hypokalemia and nocturia. But just remember, if anything, if you have diarrhea or anything that's causing your body to lose too much, so urinary output, like over here, a diuretic, it's going to cause imbalance of electrolytes. So particular what you want to watch out for here is hypokalemia. You never want to give a diuretic IV push. You want it to infuse over 5 to 10 milliequivalent per hour. Especially because it irritates the vein. Too much diuretic could affect the kidney, so you want to check the BUN and creatinine level. And like I said before, one of the side effects are hypokalemia, so you do not want to give if a patient has hypokalemia. They do have potassium-sparing diuretics, so for that, you don't want to give to a patient that has hyperkalemia, because if they have too much potassium, you don't want them to be saving it and then having even more. So some type of diuretics are mannitol, which is an osmotic diuretic, which is used for cerebral edema, so ICP, and glaucoma. And side effects for that are pulmonary edema. So you want to auscultate the lungs after. Another type of diuretic is thiazide diuretic, which those ones end in thiazide, so it's e.g. like hydrochlorothiazide. This could also cause hyponatremia, hyperuremia, hyperglycemia, and photosensitivity. In general, all diuretics, you want to take them in the morning because they make people pee a lot and you don't want them to keep getting up at night having to go to the bathroom. So another type is loop diuretics, which includes furosemide, bumetanide. For that, I would know that could cause ototoxicity. And the potassium-sparing diuretics that I mentioned before are spironolactone. The next thing we're going to talk about is electrolyte replacement and other stuff like that. So potassium chloride, as the name says, potassium, which is KCl, so it's given to treat someone with low potassium. You should never give it by gravity, and it could cause GI upset if taken by pill. So give it with food and with a lot of water. The next one we're going to discuss is sodium polystyrene sulfonate, which is known by most people as K-exolate. So how I like to remember this is K-exit, K is potassium, and it's used for people with high potassium level. So you're trying to get rid of the potassium in their body. Complications could be intestinal necrosis. So as always, if you're trying to get rid of something like, let's say, potassium, you want to watch for the opposite to occur, too little potassium. So watch out for those signs, like lethargy, stuff that have hypokalemic signs. Another side effect is frequent loose stools, which is normal, but it's a side effect. And you want to watch out for fluid overload, because it could cause intestinal necrosis, so the patient has to have a normal bowel function before taking it. The next medication is calcium acetate, which is known as phosphalo or calcium carbonate. This is used to excrete phosphorus. So calcium always binds to phosphorus and helps to excrete it. It is used to treat a high phosphorus level in the body, like with end-stage kidney disease patients, etc. Another medication is filgrastim. That's used to increase white blood cell count. It's a lot of times used with cancer patients or people would have low ones. Another medication is epoetin. That stimulates the production of erythropoietin and red blood cells. It is used to treat anemia. Side effects are hypertension, and you need iron, vitamin B12, and folic acid for it to occur. Okay, so next we go on to H1 receptor blockers, which are antihistamines. What they do is that they decrease the inflammatory response by blocking histamine receptors. So they're used for allergic reactions. They include fexofenadine, loratadine, diphenhydramine, which is Benadryl, etc. The next one we're going to talk about is anesthetics. So that includes epidural, as anyone who has a kid knows, which is a local anesthetic. It is contraindicated in someone with uncontrolled hypertension or coagulopathies, so extremely low platelets, clotting disorders, or an infection at the epidural site. Other types of anesthetics are propofol, which is usually used when someone is intubated to keep them sedated. The next one we're going to talk about is tocolytics. So this includes terbutaline and magnesium sulfate. As we said before, magnesium sulfate, therapeutic level 4 to 7. Another tocolytic is indomethacin and nifedipine. Tocolytics are used to suppress the uterine contraction in preterm labor. So if someone comes in preterm labor, you want to suppress the contraction so they don't go into labor. It prolongs the pregnancy for 2 to 7 days. The reason why you'd want to do this is because you want to give steroids to mature the baby's lungs. The next medication class is uterotonic drugs. These are used to increase contractions. So usually if they want to induce someone like that. The most common one is oxytocin. This could also be given if attempts to control the postpartum bleeding does not work. A side effect of this is uterine tachysystole, which is more than 5 contractions in 10 minutes over a half hour. Some other uterine tonic medications are carboprost, misoprostol, and methergin. So methergin could be used to treat severe bleeding postpartum also. The next class of medications are phosphodiesterase inhibitors. These are used for erectile dysfunction. Do not use these medications with nitrates. As we said before with nitrates, in the nitrate class, don't use this with erectile dysfunction medications. These all end in -phil. Tadalafil, sildenafil, vardenafil. So the next class of medications are anticoagulants. These are used as blood thinners to prevent blood clots. These I would know because many people are on blood thinners. You know, to prevent blood clots, which prevent strokes and heart attacks, like that. So, heparin, enoxaparin, which is Lovenox, and dalteparin. So with these medications like heparin and enoxaparin, like that, you want to monitor the PTT. Normal PTT is 25 to 35 seconds. But on heparin, you want it to be 1.5 to 2 times the normal value. If someone's PTT is too high, they're at risk for bleeding, which is why you really want to monitor that. Heparin is a high alert medication because it could cause significant harm to the patient if it's given in error or wrongly. A complication with heparin is heparin-induced thrombocytopenia, which is more than 50% lower platelets, which you would see the patient had petechiae, purpura, like that. signs of bleeding internally. You want to give it for 10 to 14 days following orthosurgery to prevent DVTs. An antidote for heparin is protamine sulfate. A hint for that is like this is the protocol for heparin, like that. Another type of anticoagulants is warfarin, which is known as Coumadin. So with this, you want to monitor the INR and PT. So the other one was the PTT, and this one's the INR and PT. The therapeutic range of the INR is 2 to 3, but if someone has an artificial heart valve, it's 2.5 to 3.5. With warfarin, vitamin K could affect it. So you want to tell the patient not to increase the level of vitamin K and not to decrease the level of vitamin K they're eating to remain constant. You do not want to give warfarin during pregnancy, and you want to give it 24 hours before surgery. As all anticoagulants, it could cause bleeding and thrombocytopenia. Some other anticoagulants are rivaroxaban, apixaban. So with anticoagulants, the main thing you want to watch out for is bleeding. So some bleeding precautions. You want them to shave with an electric razor, soft bristle brush, report bleeding, have a baseline CBC. You want them to watch for internal bleeding signs, which include blood in the urine, back pain, mental status change, black tarry stool, epistaxis, bleeding gums, etc. You do not want them to take aspirin or herbs like ginkgo biloba, ginger, garlic, because these increase the risk of bleeding also. They should not be taking NSAIDs because it increases the bleeding also. So warfarin takes 48 to 72 hours to take an effect, and then a few more days for the maximum effect. So you want to overlap them, so give them like around 5 days of heparin till the INR therapeutic level, and you want to explain to the patient why you're giving them both. The antidote for warfarin overdose is vitamin K. Some other anticoagulants include factor XA inhibitors like rivaroxaban, dabigatran, etc. These are anticoagulants, but they have a lower risk of bleeding, and you need less monitoring. So you don't need to do the PT, the INR, the PTT, but they do have a risk for intracranial pressure bleeding, of ICP bleeding, epidural hematomia. So if someone has any neurosymptoms with this, tell your doctor immediately. Some other anticoagulants are clopidogrel, so Plavix, abciximab, etc. The next class of medications are thrombolytics. So you should know the difference. Anticoagulants are blood thinners to prevent blood clots. Thrombolytics are if someone has a blood clot, it's used to treat blood clots. These include alteplase, they all end in place. So just remember place, like the blood clot is in place. Retroplase, alteplase. This is contraindicated with active bleeding, recent trauma, aneurysm, AV malformation, history of hemorrhagic stroke, or uncontrolled high blood pressure. There's a risk for intracranial hemorrhage. So you only want to use for life-threatening conditions, and do a CAT scan and make sure they're not bleeding internally in their brain. Okay, the next class of medications are used to lower cholesterol levels. These a lot of people are on. Just know they end in statin. So rovastatin, etc. The main side effects I would know for these are rhabdomyolysis, kidney injury, and myopathy. So you want to tell the patient to report any signs or symptoms of muscle aches, weakness, and to take their CK levels. This medication is metabolized through the liver, so you want to assess for liver function tests. It's contraindicated in patients with severe liver injury or muscle injury. You would rather them take it at night or evening because cholesterol broken down in a fasting state. Some other types of medications that help to lower cholesterol are cholestyramine, which has the word cholesterol in it, which is, the way it works is it helps excrete the bile through the feces, so it decreases cholesterol. Another cholesterol medication are fibrates, which include gemfibrozole, has like fenofibrate, and another type is niacin, which is vitamin B12. Just some random vitamins I thought I would add in here. So vitamin D helps to maintain bone density, and vitamin E is used to prevent leg cramps. Here are just some other anesthetics, which all end in cane: lidocaine, benzocaine. So though it is an anesthetic, lidocaine could also be used as an antidysrhythmia. Another medication I would know is dopamine. This is a symptomatic inotropic. It is used to treat symptomatic hypertension. What it does is that it improves the blood flow in shock or heart failure, and it enhances cardiac output and renal output. Side effects can include tachycardia, dysrhythmias, etc. Another medication I would know is milrinone, which is Primacor. This is used to increase contractibility and promote vasodilation. This is also an inotropic agent. So inotropic agents, they play with the force of the muscle contraction. So if it's a negative inotrope, then it weakens the force of the muscle contraction. If it's a positive inotrope, it increases the force of the muscle contraction. And remember, the heart's a muscle. So as I was just saying, milrinone is an inotropic agent, just like dopamine, and is also used for heart failure for patients that are unresponsive to other drugs. Some other medications are anti-Parkinson medications, which include carbidopa, levodopa. Okay, so this medication increases dopamine levels in the brain. Some side effects are orthostatic hypotension. Anytime you see that, just remember fall precautions. Harmless discoloration of secretions. Involuntary movement. It takes several weeks for the maximum effect. If it's taken too much, it could cause dyskinesia, which could be very dangerous, so tell your primary care. The medication does not eliminate tremors, it just decreases them. Other medications that are used to treat anti-Parkinson for tremors are anticholinergics like benzotropine, etc. Another thing I want to mention is oral poisoning. You want to give them activated charcoal. Another medication is riluzole, which could used to treat ALS. It slows the neuron degeneration, and it could slow progression by 3 to 6 months. There's no treatment for ALS, but this just helps slow the progression. Some other medications, I'm just going to go through these because I read the medications that are seen on the NCLEX and you should know, but they don't fall under specific categories. So, zolpidem, which is Ambien, this is a hypnotic. It's usually used for sleep disturbances, like people who can't fall asleep, for mania, etc. Another medication is melatonin. This is actually a supplement, and a lot of people use this for jet lag. But if you have high doses, it could cause vivid dreams, nightmares, and you want them to take it only take it when they get to the designation. Another medication, lactulose. This is an asthmatic laxative. This is commonly given in nursing homes because a lot of patients in the nursing home suffer from constipation. How it works is that it promotes excretion of ammonia through feces. So you want to monitor electrolytes with this because, as I said, anything that causes someone to pee it out or comes out or diarrhea, they're losing electrolytes. So you want to monitor their electrolytes. Another type of fiber supplement is called bulk forming fiber supplements, which is Pasila, methylcellulose, wheat dextrin. Those also help with constipation. Another medication is sulfasalazine. This is a GI anti-inflammatory medication used to treat IBD, irritable bowel disease. Side effect is dehydration. It also could crystallize in the kidney, so you want to report dehydration because dehydration is very bad for your kidney, or elevated specific gravity. It could also cause yellow or orangish tinted skin or urine. Another medication is permethrin 5%. This is permethrin 5% is actually a cream that is used to treat scabies. You want to tell them to massage it all over their skin from head to toe. It's used for children and infants. Another medication is called isotretinoin, which is Accutane. So isotretinoin, it's used to treat severe acne. And the main thing you want to tell people about this is that it is not used in pregnancy. So a lot of people that have acne are usually teenagers. So what you have to do is that if they're in childbearing years, you need to have 2 forms of contraception for 1 month before starting it and 1 month after. And they have to sign an I pledge form. You also need 2 negative pregnancy tests before giving, and some side effects, besides for the pregnancy side effects, because it's a category X pregnancy, is dry eyes, dry mouth, dry skin. Other side effects, severe side effects, are photosensitivity and Stevens-Johnson syndrome. Also, just a side point, it's made with vitamin A, so don't take it with any vitamin A supplements. And don't take it with TCA, tricyclic antidepressants. So here are some more medications. Norepinephrine, which is Levophed. This is a vasoconstrictor and a Vessin. So what a Vessin means, it could cause skin breakdown. If that does occur, you could give the antidote, which is phentolamide. Norepinephrine is it improves heart contractility and output. Epinephrine, but it's used for cardiac arrest, lactic reaction, and severe asthma attacks. Another medication is called colchicine. This is an anti-inflammatory used for gout attacks. It has GI side effects. See, I wouldn't really remember that because GI side effects doesn't really make a difference. Because if someone come to you and say I'm nauseous, you wouldn't not give them their medication for their heart because they're nauseous. What you want to watch out for as a nurse is severe side effects. So if there's any side effect, respiratory side effect, heart side effect, I would know those, Another medication is allopurinol. This is also an anti-gout medication. Another medication is promethazine. This is a suppository that is used to relieve nausea and vomiting and to minimize further fluid loss. Another medication is pyridostigmine. This is used for myasthenia gravis. It increases muscle strength. Another medication is finasteride, Proscar. So this is used to treat an enlarged prostate, so BPH. So this is the last slide of medications we have. So thyroid medications. For patients with hyperthyroidism, you could give them PTU or methimazole or radioactive iodine. So for someone with hypothyroidism, or if their thyroid was taken out, you could give them Synthroid, which is levothyroxine. You want them to take this in the morning and 30 minutes before meals. You want to dose it based on their THA level, and you want to report signs of excess thyroid hormone, which is like heart palpitations, tachycardia, weight loss, insomnia. It could take up to 8 weeks to see the effect. The reason why you want to take it in the morning and before meals is because antacids, calcium, and iron could interfere. Usually when a patient's put on this, they're put on this for lifelong. Some neuropathic pain relievers include pregabalin and gabapentin. Another medication I would know is clomiphene, which is Clomid. It is used to treat infertility. It stimulates ovulation. The patient takes it orally for 5 days, and then ovulation should occur 5 to 9 days after completing. They should have frequent sex during 5 days after completing, like every other day for 1 week. And side effects could be twins, mood swings, hot flashes, nausea, and a headache. The last medication I would like to discuss is capsaicin cream. This is over-the-counter analgesic that relieves minor pain. So like for neuralgia, osteoarthritis, it's actually made out of hot pepper. You'll want to wait 30 minutes after massaging the cream before washing your hands. Side effects are just like local irritation, burning, stinging, and redness. So thank you so much for watching. If you want this in a PDF form, please go to my website. You can look below for the link, and subscribe and like this video, and stay tuned for more. I hope this was clearer.